Have you ever wondered what your life would look like if only you could change the course of its direction? Well, you can if you change your mindset. You see, your mindset has everything to do with the decisions that you make, and it's these decisions that will create your destiny. This is known as the domino effect. In each one of our shows, I will be interviewing various wellness professionals that can change your life, personally, professionally, financially, and environmentally. All that is required is an open mind. Hi, and welcome to the Domino Effect. I'm Tina Marks, and today we're in front of the Indian Wells Smile Center. And we're gonna go inside and talk to Dr. Feld, who is a dentist, and a lot more. Let's go inside and find out why. Today we're here with Dr. Feld, who is a craniofacial diplomat and an implantology diplomat. Welcome, Dr. Feld. How are you doing today?
I'm great.
Good. Can you tell us a little bit about your background and what got you interested in the dentistry?
I lived in many places, and so when I came to America, I was born in America, and then we moved away, and then I came back again, and it was hard for me to fit in because
You'd moved so many times in and out of the country.
Yes.
So do you think that caused a little bit of a learning?
I didn't know. At the beginning, I had a hard time with school. As I grew up, my parents were just trying to make it type thing, and so we really didn't experience any outside influences other than what my parents grew up from. Mm-hmm. And since they were immigrants, we dealt with people that were other immigrants, and so that was the world I lived in when I wasn't in school. And when I was in school, that was a different world. I went to community college, and I went to every class. I didn't skip, even though I played on, I was an All-American soccer player. Oh. Because of my parents and the European influence. Okay. I also was a California state champion in yo-yo. And, well...
Are you pulling my leg now?
No.
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 Okay.
I got involved in yo-yo because if you learn these tricks, they would give you badges. And I thought that was cool because I never had a badge. And so you got these awards, and then they gave you a sweater to put it on.
Okay.
And so then they had some tournaments, and I won a bicycle. And then I go on stage, and then I won a scholarship, and they gave you money. Okay. It was kind of cool.
That is cool.
Yeah, so they used to call me Yo-Yo, but some people still do.
Yeah.
I served in the service. I was a dental assistant, and I ran a hospital. Mm-hmm. And I worked with a lot of physicians and dentists. So when I went back to school, they wouldn't let me in school because my grades were so bad. So I had a kind of an in. The dean at the university I used to play golf with. Mm-hmm. And so I said, what am I going to do? I was out there fighting for the country and all that stuff and doing things that you're not supposed to talk about. And he says, yeah, I know, but your grades are so bad, I can't get you back in. Mm-hmm. And he says, I'd like you to go to night school to make up some grades, and so I can then vouch for you and say, look, he's back and he's different. He was a nice guy, Dean Brady, and he was a really, really nice guy. I said, okay, what do I take? He says, I don't really care what you take. You just go, take 2 or 3 courses, get a couple A's, and then I can get you back in. I said, okay, you got it. Getting a couple, I never had an A.
The power of positive thinking.
Well, I don't know about positive. I said, sure, that's good. Somehow, what happened was I got those classes, and through determination or something or other, I made up all those classes. Mm-hmm. To this day, I don't know how I did it, because I know I never saw the daylight. I know
you were studying that hard.
I never went out on a day. I just never did anything except get ready for class. I also had 2 jobs because my parents had no money. I didn't have any money. And so I had 2 jobs working, and I had a full schedule, and I made up my grades in 1 year. But I ended up doing well enough so I could get into a 4-year school. Okay. So I went to Cal State, and then I got involved there. And when I went there, it was big classrooms, a lot of people, really scary. and I didn't know what to do. And I remember walking in the first class and I was just sweating. and perspiring and going. The only thing kept me going, I said, if these guys could do this, you know, the other doctors, if they could do that, I could do it.
That's what kept you
That's
going.
the only thing it was. So I think that in order to have something to move ahead in life, you have to have some either inspiration or some sort of dream or something that that you feel that you've. And I think because I was good at yo-yo and because I was good at tap dancing and because I did accomplish some other things, at least it gave me some what you call self-esteem in other areas that maybe I could rely on. But that's not going to get me through school. But at least it was something.
But it gave you the confidence to say that maybe you could. I'm so glad that you did graduate because you are top in your field, and according to a lot of patients that I have met, you are their hero.
Thank you.
My earliest recollection of pain was probably when I was in grade school. I would complain, oh, my ears, my ears. My mother would say, we've had your ears checked and they're fine. And basically, I think that that's where it started and eventually down into my lower back. The ones in my lower back would just be crippling. I mean, sometimes I would just have to go to bed for a week at a time. And my left hip would always be lifted up into a very uncomfortable position where I just couldn't unfreeze it. There was nothing I could do to walk in a normal fashion. I was sent to a neurosurgeon when I was probably in my 30s. And he told me that my back was in bad shape. I needed back surgery. At one point, I just felt like there's nobody that knows what's wrong with me. Right about that time was when I met Dr. Feld. He was totally different than any doctor I'd been to. He was very just assessing me as soon as he saw me. He told me that he was going out on a limb and he'd have to do the test, but he said, I think I'm your guy. He started yelling, I got it, I got it, I got it. He was so excited, and I said, what? And he said, what do you mean, what? You know, he said, I can, you know, the good news is we can fix this. This friend asked me, well, so where are you having the pain now? I said, I'm not having any pain anywhere in my body. And she said, you're kidding. I said, no. I could cry just thinking about it. I couldn't do anything before. I can play tennis, I can swim, I can hike and bike, I have total freedom.
My name is Roger Dibble. I am a former golf professional, and 10 years ago, my back blew out. Lower spine, L5-S1, and then the vertebrae above it. For the last 10 years, I've had acute pain. For me personally, I went to him, I went through his testing, and he says, yeah, I can help you. So kind of blindly, I went into it with the idea that maybe my teeth will get straightened. Lo and behold, within a week, I start feeling relief from my back. My back has been blown out for 10 years. I've been a patient of his since March. 0. From a scale of close to 8 to 9 on the pain level, 0. Lower pain, and that's where the back pain was. This little piece of plastic that has cured me of my back pain, I can eventually take out. It realigns you. This man is in the upper echelon of what he does in the world, for sure. I'm playing pain-free golf, which is phenomenal.
So Dr. Feld, you specialize in chronic pain disorder, and that can be anything from dizziness to anxiety to sleeping problems to Parkinson's to back pain, neck pain, nerve pain, which is pretty much fibromyalgia, correct?
The thing is, I don't cure anything.
Right.
But what we found is with the stuff that I work with, that affects many, many different things, or causes certain things to happen.
Okay.
I've been a practicing dentist for over 20 years, and I was very involved since a long time in implants, and I studied implants with some of the founders of implantology.
Just for our viewers who don't know what implants are used for, implants primarily are used for?
I might have one here. I don't know if we can, maybe I don't. Oh, Implants are used actually to replace missing teeth.
Missing teeth.
Okay,
Right.
and so this particular case has no teeth, and we put these things inside the jaw.
Okay.
And they're
these
metal.
These
and
screws.
The screws go inside the jaw.
Inside the jaw.
And it's not painful. If it's done properly, you have it the rest of your life. And they replace the teeth that are missing.
Okay, and they attach because...
Yeah, and then you make teeth that attach to the implants.
Now, what's the difference between this and veneers?
Well, veneer just covers the tooth.
Covers the tooth, and this is for people that are missing their teeth.
Missing teeth.
Okay.
But fortunately, we can also make it pretty.
You can make it, oh, that's good.
You know,
That's
so
good.
we make it pretty, and if a person is missing a tooth for many reasons, if they're missing part of their face, I grow the face back, I go get bone somewhere in the body and replace the face, and then the wrinkles disappear and they have teeth.
You know, you and I were talking about that. You said a lot of the reason that we start getting wrinkles or we start getting collapse in our face is because of the alignment of our jaw.
That is correct.
So you could put plastic surgery out of business. If our jaws are aligned correctly, we shouldn't be concaving or sagging or anything in our face.
That's one of the...
Which I think is fascinating. That was fascinating to hear
we
that.
might have to have another show on that one.
We might have to, okay.
So I came in to see Dr. Feld for another person after I heard him speak at our Rotary group luncheon. And while I was there, he started asking me if I had any of the symptoms that were listed on the sheet of people that he treated for their symptoms. And so I said, well, I have some of these things, but I don't have any jaw pain. I don't have any, no one's ever told me I have TMJ. The sleep took a little bit longer, but I got there probably within a month or two. I was sleeping almost through the night. So he did them, and some balance things and some pressure points and things like that. And he said, I think you are a candidate to wear an appliance. And I was like, well, there's nothing wrong with my jaw. And he said, well, all of these things I believe are because of your jaw. So I made an appointment, we did further testing. I was very much a doubting Thomas. I did a lot of research, asked a lot of questions, and he finally fit me with an appliance. My symptoms were headaches, neck and shoulder pain. I was not sleeping almost at all at that point. I was getting maybe 3 hours of sleep a night. So that presented all kinds of other issues with memory and concentration, and my quality of life was not good. And so he fit me with the first appliance, and within a week the headaches were completely gone. The sleep took a little bit longer, but I got there probably within a month or two. I was sleeping almost through the night, and then the neck and shoulder pain was some of the last to leave. Yeah. I did have some ear congestion in the beginning, and that disappeared immediately, probably as quick as the headaches disappeared.
Tell me the story about your daughter.
Well, I was on staff at 2 hospitals, and I was involved in implants. And implantology is a science, and we're doing that in my offices. And so along with implants, I do dentistry, we do the crowns and the bridges, and I was just a regular dental guy that was kind of specializing or trying to focus his energy into the implant field.
Okay.
And lo and behold, I have this challenge with my daughter. She was having, we didn't know it, but she was having migraine headaches at the ripe old age of 13, 14.
You know, I've been hearing this. The younger and younger girls and boys are having, I heard this probably 4 times, about an 11-year-old
Really?
that was having headaches, yes, and this is why. And
So we see this, but this was also like 12 years ago, so we took her everywhere to try and get help, and nobody could help her, and nobody knew what it was, and they told us to take this pill and this pill and this pill, and my wife is not a pill person, and she doesn't believe in pills, and we couldn't get a diagnosis of what was wrong with my daughter, and she couldn't remember things, and she'd fall all the time, and she was dizzy, and then she'd trip and fall, and the teacher thought she was trying to act out and create attention. And so they came to me and said, she's not going to make it through high school. And so I said, what do you mean she's not going to make it? He says, well, she just can't do the work, she can't do this, she can't keep up. And so you need to send her to a special school. And it turned out that she was already in a private school. I said, what do you mean special school? What are you? You know?
Right.
Where do I go from here?
Right.
Well, there's special schools that you send that people are just kind of don't have it together. And I said, well, my daughter's fine. She communicates fine. Everything's great. So what's the problem? So she was a normal kid, but somehow couldn't get through school. And guess who used to have that same thing?
Yes, exactly. You did. That's you must have thought about that. I mean,
yeah,
you must have thought,
but okay, so
it's
is
a
it
gene that's been
genetic?
passed.
Is it passed
Exactly.
genetic? It's my fault. I did it because I was an idiot and I didn't know what I was doing. And so now she's got the same problem. Long story short, we found out that we did braces on her and we pulled her bicuspids out. We made her mouth smaller and there was no room for her tongue, and it turned out that the tongue went backwards and she had a breathing problem and she wasn't sleeping at night. And she was clenching at night, trying to breathe all night. And as she was doing that, she'd wake up with a headache and a migraine because she was working all night trying to stay alive.
Oh my gosh. And how did you figure that out?
I didn't. I mean, I went around the country trying to figure it out until someone said, this is easy. Put this in her mouth and she'll get better. So we did, and you know, I went to school again. I started school all over again, but this time I kind of went with a different
objective
passion. Yeah, I was obsessed.
Yes.
And
when it comes to your child,
yeah,
of course.
I probably did as much work in 2 years as most people do in 10.
So is this the first time that you ever made an appliance for anybody? Was for your daughter?
Yeah.
You did. So this was the first one, and it worked.
When we made her the appliances, we had a tough time at the beginning, but then all of a sudden she just perked up and everything got better because she was sleeping, headaches went away. Now she's in graduate school.
Cool.
And
so now you know you're onto something. You really know that you're onto something.
I mean, now I do, but I mean, at that time it was like, what is this? What is this? And so wherever you went, everybody said, oh, I said, well, then help her.
Right.
Nobody. I said, if you don't poo it unless you can.
Absolutely.
Help
Absolutely.
it, you know,
yeah.
give me an answer. And there's books written about it, and there's all this stuff about it, and it's like.
But it wasn't mainstream.
And I teach at the university now, and it's still not being taught.
It's still not being taught in school.
No.
That's amazing.
I was diagnosed with fibromyalgia. I had like stabbing pains in my side. I had aches over my whole body. I actually had tingling going up and down my arms and sometimes my legs, but my arms were the worst. At one point, a doctor had wanted to do surgery on my neck. He felt that that was the cause of my the tingling in my arms. And I have heard bad things about that type of surgery, so I wasn't interested in doing that. I also was a snorer. Those are minor things, but I was a snorer and I had trouble sleeping. Dr. Feld started me on a program with a pivot first, where he attempted to change the location of my jaw. The x-rays showed that I wasn't connected at all. I had TMJ so bad that I wasn't even in my sockets. I was sort of just, it was like my jaw was just hanging on and the muscles were doing all the work. Within about 2 to 3 weeks of using the pivot at first, my husband immediately reported that I stopped snoring. Now, when I first came in here, I could barely walk. It was really painful. I spent a lot of days in bed. My life was, I just didn't have a quality of life at all. I don't feel like anybody's stabbing me, and my quality of life has just vastly improved. I've had a couple of other non-related dental emergencies that he's gone out of his way to help me with, above and beyond the TMJ. So I can't recommend him highly enough, and his staff just cares so much. They're very personable, all of them. They care about you. They ask about your life. You don't feel like you're coming to a dentist.
Which model can we use to show where the arteries that go to the brain? Would it be this one?
Well, oh, we lost his head.
You lost half a head. That's me half the time.
One of the challenges are that this whole system obviously is very complicated, and you don't really learn this in dental school and medical school. You have to go to specialization to do all this stuff.
Yes.
Because for some reason they think it's complicated. It really isn't.
Right.
But the jaw here works in a way up and down, and has a little piece of cartilage that separates the two pieces. And I have videos that people can watch on this. But there's an artery here that goes to the brain. It's called the carotid artery.
Yes.
And you can feel your pulse. If you take a finger and you put it right here in front of your ear and behind the jaw, you can feel your pulse. If your jaw goes too far back, because this little cartilage kind of slips off for some reason, by definition, if it's not on, it's off. And we're not talking about miles here. It's just a little itty-bitty space. Then the jaw goes into a different space. Now, the tongue is also attached to the jaw.
So it's going to make the tongue move.
Right. So if the jaw goes backwards because this little cartilage is not in the right place,
then it's going to pinch
the artery.
This
and nerves,
artery.
Yes, that are back here.
Which brings the oxygen to your brain.
Right. Now, not only that, but you know, if you step on a hose.
Yes.
And you push on this.
Yes.
Does the heart have to push harder?
Absolutely, to try and get the water through.
So then we have strokes and we have heart attacks and things like that. So can be associated to this.
Can this cause high blood pressure?
Absolutely.
Yes.
We know that. There's articles on that. Today, in today's market, the easiest thing to do is take some medication to lower the blood pressure.
Absolutely, but that doesn't work all the time. I have a friend of mine who they've been trying a variety of different blood medications, blood pressure medications, and nothing is working. Nothing is lowering.
Do they know why it's
They don't know why. They don't know why. So I'm wondering, this might be the problem. Her jaw might be out of alignment.
But why are they giving them medication if they don't know why or what's causing it?
That's a very good question, but that is common practice.
Well, that's part of your domino thing. I mean, why are we doing what we're doing?
Because we're trying to get to the root of the cause. We're not trying to put a Band-Aid on it, and it's too easy nowadays to just hand you a pill. If you're experiencing pain, here's some pain medication, but that doesn't make the pain, until you take the next round.
You're getting hostile here.
I feel very passionate about this subject because, I think most older people, by the time they get to, 70s, 80s, they've got an array of pills that they're taking that are just masking what the root of the problem is, and those pills, my understanding is there's always a side effect for one of these pills.
Well, the other thing is it's very easy to see.
Yes.
If a person has a crooked jaw, then it's not lined up right.
How can you tell that I have a crooked jaw?
Well, because...
By looking at me?
I'm watching you talk, and your right side's lower than your left.
My right side of my jaw is lower than my left. Okay, so...
You want to show the people at home?
Yeah.
Open. Okay, show the people at home. What I'm going to do is change the position of your jaw.
Okay.
And show you a few things.
Okay.
Bite down. Good.
Don't break it, just bite down.
Hold your arm. Just hold it there. I'm going to push down, you push up. Ready?
Okay.
Hold.
Okay.
Oh, you work out. You work out?
I do.
Oh, okay. So now hold it. Ready?
Okay. Oh, try it again. Try it again. Okay. No, wait a minute.
You try it again. No, try it again.
I'm trying.
Come on, you ready? Focus.
I'm focusing.
Focus.
Okay,
Close your eyes and focus.
Ready?
No,
that's amazing. I am holding it. What?
No, you're not holding it. You're falling.
Why is my arm going down?
Because your jaw's crooked.
So that's affecting.
You want me to explain the whole thing here?
I want you.
You got to come and do my seminar.
Okay.
Okay. Hold it.
That is absolutely amazing. Okay. Okay. Now put it back in my mouth.
Right. Hold it.
No, are you kidding? That's crazy.
I got marks on your hand. Look at that. How hard I was pushing. The jaw works. The right side and the left side are supposed to work together.
Okay.
Right? They both have these little pieces of cartilage
over here,
on top.
so we can see. Yes.
So the right is the same as the left.
Yes.
Okay?
Yes.
So people aren't usually born with one side bigger than the other, but sometimes they are.
Okay.
So let's say it is, or
Okay.
let's say you're off a little bit, and let's say this is longer, or not. It's not going to function the same. Does that make sense?
Yes.
If you got big wheels on one side of your car and little wheels on the other side, is it going to have an even ride?
No.
Okay, so
No,
that
so
might
one
be
side, right.
That might be the case. It might be a case of someone gets a whiplash, and this little cartilage kind of slips off, and now
Can we get that in the camera? See,
Probably
this
not.
is where it all starts, right? It's this piece of cartilage
this little
right
mechanism
here.
Yeah. So
here.
if this is not in the right place, and you see, it's not a very big space.
No.
So I mean, if this is just off a little bit, and it's here, this jaw is not going to be in the same place that the other one is.
Yes. Yes.
So can they possibly work the same?
No. No.
I mean,
Yes.
if you have a sprained ankle or
Yes.
something, you start walking on
Right.
the other side.
Right.
And so this is just, somehow the brain is doing this, and so people all of a sudden have these bending heads and all this stuff.
Yes.
And so I give them an appliance, move the jaw so they can breathe, and all of a sudden They straighten up.
Everything starts to straighten up again. Yeah.
It's amazing.
It is amazing.
So then I'm a voodoo guy, because I'm the voodoo doctor, because I put things in people's mouths and they get better.
So let me ask you
But if I do this to you and you say, well, what do I have to do? So then what I do is I do testing where I take x-rays and try and find out if there's something for me to treat.
Right.
So we do that, and then that's what we treat. We treat it with something very simple. These things are little plastic appliances the patient wears at night.
So this just goes over your teeth?
Yeah.
Okay.
That's an upper.
This is an upper. Okay, so you would put it up in like this.
And so this is
It's kind of like a retainer, like you would have a retainer when you were.
So we retain your life.
So you have one for at night and one for during the day, correct? Right. Okay, and then do people have to wear this the rest of their lives, or?
Depends.
So sometimes, if it's more severe, they might have to.
I've been wearing glasses for about 40 years. I don't know why they can't get it right.
But some people, they can be weaned off.
Yes,
right?
We have patients which you've met that are no longer wearing appliances.
They're no longer wearing that, and you know.
But that depends on the amount of damage, how soon they get to us.
How long they've been living with it that way. Okay, so it looks like I'm going to need one of these. I'm going to need one of these appliances. Can you make me one of these?
Can I make you one?
Yes.
I don't really make them. I have a lab to make them.
You have a lab to make them, but so you'll take X-rays and you'll see.
The question is, what is causing this stuff? I don't know if I can help you.
Okay.
Okay.
But you might be able to. You might be able to put me back in alignment. You can get rid of my bag.
Obviously, something is not right.
My bag and my jaw and right. Yeah, but my point is, I don't want to wait until I maybe do start experiencing problems, whether it's dizziness or motor skills. You know, as you said.
Well, yeah, but you just asked me that, so we're doing this for the first time because you asked me. So, do I have this?
Did I fail like that? Did I fail with the lip?
So,
anyway.
So I don't know if I can help you.
Okay.
I mean,
but you could certainly try. You're gonna take some tests.
Right. We'll do some diagnostic tests and find out what you got, and then say, okay, let's try this because this will do that and this will do that.
Okay.
And then we can find out.
Okay.
You don't have the chronic situation. You don't have headaches.
No.
You don't have migraines.
No.
You don't have dizziness. Well, you do have a balance problem, but. We won't admit it.
You know what I think we should do too? I think we should maybe do a follow-up show to see what happens after this, and then if I do, okay, it's a deal. Thank you so much for coming on the show, and I think we're going to be helping a lot of people out there. Anybody that is experiencing any of these problems, whether it's sleep, it's dizziness, anxiety, motor skill functioning problems, please come to see Dr. Feld. He's absolutely amazing. Thank you. And today we can see how the domino effect is at work here. It affects you personally, it affects you professionally, and it affects you financially. And let me tell you why. Because personally, if you're not feeling well, you can't be the best that you can be. Professionally, it's going to affect you because, again, if you're not feeling well, you're not going to be able to do your job very well, now are you? Financially, you know, you could spend thousands of dollars going to different doctors and different diagnoses, but if you can find something that can eliminate your pain and put you back on track, making you feel great, then you know, I think it's worth it. There it is, the trifecta, personally, professionally, and financially. If you'd like to be a guest on the show, please contact us at this email. Thank you for being with us. I'm Tina Marks.